Welcome back to the 1% Doctor Podcast. I'm your host, Adam Lamb, and today I have my friend, awesome guy, awesome doctor, Dr. Frank Contessa. Welcome to the show. Thanks for taking the time and being here. You have an awesome story. It was crazy. Dr. Frank and I met. We had both been on Newsmax together talking about Maha. We've been talking about all the crap that's in our food, talking about the junk that's in our water, and a lot of just better health stuff. So, Frank and I are both subscribed to a lot of the same beliefs of what's wrong with our healthcare system. So there's some cool stuff we can talk about today about that. And I want to hear, most importantly, Frank, let's hear your story, share a little bit about your story. Also, I think you have some really cool, you do concierge medicine. You're on the news all the time, being interviewed, and I think that's just some cool stuff. Both the concierge medicine versus the mainstream style of medicine, how it's done, and what you do from getting to be live in the news all the time. Like, that's super cool. But give us a little background. Like, what got you into medicine, and like, just walk us through the story, and we'll tackle some of it.
Sure. Well, thanks for having me, Adam. This is a great experience, and it's a lot of fun to do stuff like this. I got into medicine. I really wanted to be a doctor since I was in first grade. It's the only thing I ever really wanted to do. It started because I had to get glasses in first grade, and I went to the eye doctor. It was a young female ophthalmologist, and I wanted to know, why can't I see? And she started giving me some very simplistic answers, and I says, no, why can't I see? And she started giving me some medical books to look at, mostly look at the pictures and bring home. And I would come back and we would discuss them. And she said, you understood that? I said, sure, I understood that. She said, well, then you need to be a doctor. Yeah. And she just kind of planted the seed in my head. And as I got older, it was really the only thing I ever really wanted to do. And I was on that pathway really from day one. The pathway was a little more varied than I thought it would be. It took me to places that I didn't expect, and but I ended up where I wanted to be, which was I practiced medicine for over 20 years in New York. I had joined as a partner my doctor from growing up. He was my doctor from high school, became my mentor, and we happily practiced together for over 20 years until I pulled up stakes and moved to Florida, where I am now, and bought a concierge practice. Which we can get into in a little bit.
One thing I want to pause. I want to stop because.
Sure.
How old are you?
I just turned 50.
Right. I know some people will be listening to this won't actually get a chance to see the video. You look like you're 35. And here's the thing: as a doctor, like as a doctor, or would be my doctor, I'm looking at you and I'm thinking, what do you like? What are you putting on your skin? What are you eating? What are you drinking? There's a part of that I think sometimes physicians miss because not out of just out of lack of awareness, but there's a part of like looking healthy, being healthy, living healthy, and like the guy that's 50 that looks like he's 35, I would like him to manage how I age because you're doing the part. So I'd say that because I think that's something we don't give ourselves generally enough credit for that stuff, but you do a good job at taking care of yourself, which means like you're living what you're leading, and that's super important. So I'm going to give you 2 thumbs up, kudos for that. Sorry to interrupt.
Well, no, I very much appreciate that. I always vowed that if I was going to talk the talk, I was going to at least try to walk the walk. Because when you sit and spend all day telling other people how to live their lives, I vowed that I would at least try to follow my own advice. And the advice is very easy to follow. It takes some degree of discipline and motivation, but there's really nothing complicated about what I do. We can obviously get into some of that too.
Career too. I'm sure it's helped in your career. Like we look at some of these different health people throughout the government. I think we look at who RFK replaced, right? Is that somebody you want?
You mean Rachel Levine?
Right. To tell you about your health. In some of these other countries, like in Europe, where the Secretary of Health or whatever is like massively obese, unhealthy. You can just tell as a doctor, I'm sure you can tell by looking at them, not just by the size, but just complexion and face. Like you can see how unhealthy and probably full of chronic disease these people are, and they're supposed to be making decisions for an entire country for their health. That's crazy.
It is crazy. In my training years, I worked with a doctor who was really a terrific doctor, and her patients really loved her. But she was 4'10" by 4'10", and she would get out of breath on rounds just walking between rooms, and then we would sit with the patient, and she'd say, "Hey, you really need to lose some weight," and I would say, "Why don't you light up a cigarette and tell them to quit smoking?" And I said, I've just vowed that I would never be I would never be that person. So it's one of the actual motivations that keeps me going, in addition to wanting to live a long, productive, healthy life and maximize my own health.
Yeah.
Part of the motivation is that I will not let myself get out of shape and be a poor example to my patients.
Yeah, that's awesome. So you started, you did kind of traditional practice in New York for about 20 years, and then relocated to sunny Florida, and got into the kind of concierge style. Tell me a little bit about the concierge medicine, how it's different. And here's the deal: I think a lot of people hear concierge and they think it must be expensive, but the reality is it's affordable. I think it's very affordable.
It really is. When I was making this move, and a lot of the reason that I left New York and came to Florida had to do with the COVID pandemic, and I was really not happy with the COVID mandates and the heavy-handed way that New York handled the COVID pandemic. And I looked at what Florida was doing, and I said, you know what? After a lifetime in New York, it's time to try something else. And I was really fascinated by the whole concierge model. And for people who are not sure what that is, it's a membership fee-based practice. And the idea of it is you're going to pay a yearly subscription membership fee to be part of this practice, but you're going to get benefits like a much smaller practice size, basically having somebody who's going to answer your calls, who, when you wake up one day not feeling well, is going to get you in today, maybe tomorrow the latest. And if you call me and have a question, you're going to get a phone call back, and I'm going to answer that question.
Right.
So
and
you're paying
they're paying for access, right? They're paying for better access, because we know, especially you look at like veteran health care, a lot of the stuff with Medicare, it might be 26 days that before you could get into, or 28 days before you might be able to get in to see it.
Or more,
right? And I don't know, but I almost feel like they like that, because then maybe the person decides not to go. Right.
That invariably does happen, or they'll say the hell with it, and they end up going to urgent care, which is the DMV with needles. So right. I really listen. Urgent care has its place. It's a Saturday night. It's a Saturday night. You have 102 fever and a sore throat, and you can't really get in anywhere else. Urgent care has its place.
But I would rather see my Dr. Frank, who I know. And that's what I'm saying. It's like the guy who knows you, remembers you, knows the name of your spouse, and like some of those things I think that matters. It makes people feel more connected. I've owned healthcare companies last almost 15 years, and that connectedness, that letting someone know they're not just a number, they're not just a transaction or a credit card, like they matter. It's great for business from retention, but it's great just from a service standpoint. Just there's a level of care that can happen a little bit more with concierge medicine versus I'm just going to go to whatever local.
For sure. And, there's really something to the doctor-patient relationship. I hold the doctor-patient relationship sacred. It's a very unique relationship, which you have to care about this person. It's a fiduciary sort of a relationship where I have to care what's in your best interest. But we're not friends. And we're not family. So I'm not your relative, I'm not your friend, but I care about you as much as somebody who is your friend or relative, because that's my job. You'll tell me stuff that you won't tell anybody else, but you're going to tell me, and I'm quote unquote a stranger.
Yeah.
But that's the beauty of the doctor-patient relationship. It's somebody it's a very close relationship, but we're not related and we're not friends.
That needs to be built, right? And I can just see, you and I have known each other and your personality, like hearing that from you is a legitimate place from your heart to those patients. But because the other side of the coin is sometimes if you don't have a relationship with your doctor, you don't feel connected, you don't trust them, maybe you feel judged, or maybe you may not share that thing. Well, hey, you know what, man, I got this weird lump on my, like that. They're just like, I'm not going to bother with it because I don't think he listens. I don't think he really cares. He always seems like he's in a hurry. And so patients won't share things. And then that thing could be something that's super important versus feeling like I'm sitting down. You're not my friend, but feeling like we're sitting down with a person who treats me like a friend, who cares, and also has the education to tell me what might actually be my problem versus telling my friend or the buddy at the game or whatever, right?
Yeah, that's right. And it's usually that last thing that they were hesitant to tell you. That's the key piece of information. Yep. Because the routine things, I have a headache and a sore, but it's that one key piece of information that they chose to tell you because they're comfortable with you. Mm-hmm. That's usually the key to the diagnosis or the treatment pattern. Absolutely. So this type of model allows you to build that doctor-patient relationship in a setting where they have access, they can get in. Just for comparison's sake, my practice in New York, I had a pretty big suburban practice in the suburbs of New York City. I had over 4,000 patients. Wow. I would see 25, 26 office visits a day. That now is down to, I have just over 500 patients, and I'll see maybe 8 or 9 or 10 people a day instead of 25 or 30. And there's always room to get you in. Again, when you call in the morning at 9 o'clock, I don't feel well today, it's okay, can you come at 11? Can you come at 1? We're going to get you in today, tomorrow the latest. So you also have that relationship where I'm going to know this person over the course of years, and you're not starting from scratch every time you come in.
Right.
So I'll know that, hey, we tried this medicine on you last year. That didn't work. You know, I know your personality. You're not going to take this medicine. You're not going to do this thing. I know you. Whereas another doctor might say, hell, why don't we have this? You're not going to do it. So I know you better. And it's just a much better way. And you talk about cost. There is an out-of-pocket expense here. But, you know, it works out to about $1 a day. You know, if you went and got, a $5 or $6 Starbucks coffee every day, that you're talking, most of these practices run between $2,000 and $3,000 per patient per year. Some of them can go much higher, but those have a higher, they might come to your house and they might do IVs in the office or come to your house and give you an IV. This is a traditional type practice, but you're going to have that expanded care, and it's a couple of $1,000s a year. People spend more in restaurants on dinner.
Oh, for sure, and that's where, where's your priority? When you don't have your health, at the end of the day, you have nothing. I don't care how much money you have, and I've unfortunately seen some of that stuff with people. And what I've kind of built my career on is working with people that want to be in optimal health, right, for over the last 15 years, and doing that stuff so that they don't have to have that terrible situation happen. And I've also been of the philosophy when we think of, we talk about finances and we talk about how much should you save or how much should you invest. And I'm like, at least you should think about 10% of your income should go to maintaining and improving your health, right, on a consistent basis.
Absolutely.
So you don't have that 500% of your income incident happen potentially later. And that's where it's like when you think of $2,500, $3,000 a year, and I'm sure there's some way that they can leverage, a flex savings account. But I mean, it's like if you're making $100,000 a year and you're a busy person, like you need to have someone that's like a concierge doc like you, and I think someone like you that cares and has the same philosophy would be vital to doing that as well.
And particularly in certain parts of the country, when coming from New York, a lot of people didn't even know what this was because we were within a few miles of New York City, where half the doctors in the country live. So there was an overabundance of doctors, but coming to Florida, primary care is in short supply.
Yeah.
And you might, I don't feel well, I'm going to call my primary doctor. Well, we can see in 3 weeks. Right. Or you can see, the ancillary staff. You can see the assistant or the nurse practitioner. You don't want to see. They're great and they have their place too, but you want to see your doctor when you're not feeling well, and oftentimes you're just not going to be able to. So this model is really expanding. And because it's relatively affordable, you don't have to be a millionaire to have a service like this. Mm-hmm. And I think there's a lot of value there, particularly if you have a good doctor who cares and you find the right person. It's brought a lot of joy back to medicine for me. Yeah. And I know it's mutually beneficial. The patients like it, but it's also pretty good for my lifestyle.
Here's the other thing I know this, and this kind of comes from my coaching consulting standpoint, is I can give people information for free and tell them how to do things, but the amount of people that actually take action and do what I say versus when people hire me to coach them.
Sure.
So when they're paying for it, they actually value the advice more. And I think that if people are paying a membership and they have access to you in that membership, they're more likely to do what you told them to do that's better for their health than to ignore it, because if it's always, even though insurance I'm sure covers a lot of the stuff, but just having that out of pocket side of it, you're putting some skin in the game, and usually it gets people to take action more when they know they're paying for something, right?
I think it creates a motivation, and you also sort of filter out people who are taking this extra step and spending this extra money. They actually want to be healthier and do the things that you're telling them. So there's almost sort of a confirmation bias where the people who are joining practices like this are taking that extra interest in their health because they're, number one, taking the step to join, and then making the out-of-pocket expenditure to join this. So they want to get their money's worth, but they're also the kind of person who is interested in improving and living as well as they can.
It's a proactive. I mean, too often we think of something like primary care as I'm only going to go to the doctor when I'm sick, versus I'm gonna pay up front to have access to make sure I stay healthy, and potentially improve my health with this particular doctor and this particular model. So I think it's awesome. I think the smart docs are going to get on board and do more of it. And here's the deal: if they have a personality and a heart like you do to help people, they're going to be super successful. If they're trying to do the same old turn and burn, everyone's a number, they're probably going to struggle to express the value in what they offer. And so I think, you know, it's a great place to get it. Where are you located specifically in Florida?
I'm in Palm Beach County, just north of Palm Beach, in the Palm Beach Gardens area, just north of Palm Beach.
I know exactly where that's at. Good area. And so let's transition the conversation. I appreciate that. I think it's probably opened a lot of people's eyes to what's possible with their healthcare with concierge medicine. I want to talk about how, you know, you and I met. We were both guests on Newsmax with Carl, who's a friend of both of ours.
Yeah.
You know, I've got a chance to be on there, you know, half a dozen times. You were on half a dozen times a month at least. Let's talk a little bit about like how you got it, because you have a cool story of how you got into it. But so let's tell everybody how you got into it.
Yeah. I got interested in doing media and television from an old friend of mine. A lot of the people who are listening to this might know the Impractical Jokers, a TV show, Impractical Jokers, that's been on for years. And I'm actually really good friends with one of those guys, specifically James Murray. And we had met before Impractical Jokers was even a thing. We had really met randomly. I had stopped to help somebody who had passed out at a rest stop on the Jersey Turnpike. And he watched it happen, and he watched me interact with these people who didn't speak any English, and I was running the scene and helping this person and running the ambulance crew when they got there. And he came up to me on the way out, and he started asking me all these questions. What kind of doctor are you? Where do you practice? I said, who the hell are you? What are you, a lawyer? What do you want from me? And so what Murr did before he was an Impractical Joker was he was a developer for a reality TV company. And we developed an idea for a reality show, and we pitched it to some networks. The show never happened. But we developed a friendship that has lasted, you know, probably 16, 17 years now. And his career took off when he sold his own show and became a big success with Impractical Jokers, which is a phenomenal show. I've been on Jokers a bunch of times, maybe in 9 or 10 episodes, where I do some crazy things, like I give a prostate exam at a real. It really happened. It was a genuine prostate exam in front of an audience of 50 people. And it was a much longer prostate exam than it really needed to be for comedic value. So I've appeared on that show, and he kind of put it in my head. He's like, man, you need to be on television. You have a look, you have a personality, you have a way of talking. And I found that I really enjoyed it. I like being in front of people. I like doing public speaking. My wife affectionately calls me an attention whore. Yeah. But I enjoy, you know, public speaking and TV. There's really, you've done it. So a live TV is really a very interesting adrenaline rush. Yeah. When you have to put the confidence in your ability to go on live and answer questions that you might not know the exact questions that you're getting. Mm-hmm. And you need to be able to answer questions complicated questions in a concise manner. You know, you're limited on these kind of TV shows to maybe 30 seconds of answering a question that could be very complicated. So you have to be concise and you have to be confident. And I just find that it's a rush. So I'm not a comedian, so being on comedy shows wasn't really the way that forward for me being on television. So I said, but I am, you know, a medical expert. I've been a board certified physician for over 20 years. Maybe I could bring that to the news setting. So during COVID, when, you know, every other segment was some doctor talking about the pandemic, I said, man, I can do that, and I can do it better than most of these people. So I ended up running into somebody who's a financial analyst on Fox News and Fox Business, and he introduced me to somebody who kind of helped me get booked on some of these shows. And they liked my message, particularly Newsmax, because I was one of the few doctors early on in the pandemic who were willing to question the paradigm and question the orthodoxy and say, man, I think something's going on here. And I had to measure my words carefully. I was still practicing in New York. I was worried about political backlash. But I was able to walk the line, and I've become a regular on Newsmax. I'm probably on Newsmax, I don't know, but 2 to 4 times a week on different shows. I do Fox Business once or twice a month. I'm on Dr. Phil's channel called Merit Street Media a couple times a month. So it's a lot of fun. It's, I just enjoy doing it. I get a rush out of it. Instead of talking to one person, I can talk to several 100,000 and get a message out and maybe educate people and teach them a little bit about a topic.
Yeah, and I think it can be great for promoting your personal brand, like getting your name out there. And it's like you said, it is a rush. It's fun. I remember the first time I was asked to be on, I was so nervous. Like they're like, here's what we're going to talk about. And I had my whiteboard out in front of me. Like I was ready to go for 30 minutes. But, like you said, it's like 30 seconds, minute and a half, back and forth. And then you're like, oh, wait, that's not, like, realizing like the information is inside. So like I have it, but there's a flow and there's a conciseness of delivering it. And my wife used to make fun of me because I'd hop on and I'd throw like a dress shirt on, but I'd still have like gym shorts on because it's on Zoom, right?
Oh, all the time.
Yeah, and so that was super funny. I think that and then it just gets easy. Where like Carl could text me now and say, "Hey, can you be on in an hour?" And if I'm available, I'd be like, "Yeah, let's do it." And it's not as nerve-wracking as it used to be, and it's not as hard as people think. I think it's just a matter of getting in and bringing value. And obviously you do that and have continued to do that well. Have you seen anything open up for you career-wise or opportunity-wise from doing that? Like anything big or something?
Oh, yeah. Well, first, I was still in the building phase of my practice here in Florida when I really kind of got into doing a lot of this media stuff. And I've definitely picked up business from that. People would see me on and like, wow, I like what this guy's saying. They look me up. Oh, he's right here and not too far from me. To the point where my practice is now full. I'm on a waiting list, so I'm not building my practice anymore. I like where it's at, but I am interested in building some of these other things like you're doing and building a brand and maybe doing a podcast of my own and maybe expanding my role in the media because I really enjoy doing it. And I think, I think that I have been blessed with some unique combination of things. Number one, I'd like to think I'm a pretty good doctor, but I also like speaking publicly, which a lot of doctors don't.
Right.
When you talk
to at it because one of the biggest challenges the docs I've worked with too is I'm like, dude, you are so smart, but unless you went to medical school with you don't understand what you just said. Right. And so because a lot of times doctors are like, they want to show how much they know. We're like, we know how much you know. You got the degree, you went to school, but I need you to help me understand what my issue is in a way that I can understand it, right? And so that was, with me in the hormone space and health optimization, all this goofy stuff is helping these really smart docs change their language to a place where I'm like, these guys know that you're the man. They need to know what you're actually saying and understand it so they can take action, trust you, and build that relationship. Because if you speak at a level that only another physician can understand, it's hard to connect with somebody, right? And so
and I think that's lost on a lot of physicians because you can't really teach communication skills. You can improve them. It's like if somebody can sing, you could make them a better singer, but you can't teach somebody to sing if they can't sing.
Right.
It's hard to teach personality.
Yes.
And actually, one of the things that I consider, and actually it was Murr from Jokers who pointed out to me, he's like, Frank, you're so good at explaining things that are complicated. I love using analogies. I very rarely use technical terms with patients or on television because people don't respond to that. So I'd like to either use an analogy or some other way to illustrate that point because that's what people understand. Sometimes you see guests come on television and they'll throw out like 9 different statistics. And you just can't do that. Maybe you choose one interesting fact and then you can build upon that, but that's not the way to communicate.
Yeah, and I've seen it with docs where it's like, is it your scapula that's hurting? And I'm like, dude, they know what their scapula is. You mean like their scap, like your shoulder? There's just a part of that where it. Look, if you're in surgery, you're the OR, like you're doing, like there's you need to use the technical terms of doing that when you're talking to the patient. And sometimes it's just teaching that skill to docs. I've seen that their practice grows, like everything grows for them because people understand that. And when you look at some of the influential docs out there, or some of the people that talk about really cool high-end stuff, they're able to dumb it down. And I love that, I'm a big analogy guy too. I have an analogy for everything. Because the goal of communication needs to be the reception of the information and how it's understood. Otherwise, you're talking to a wall, right? It doesn't matter. And then action isn't going to take it because they're uncertain. And here's what I know is people don't want to sound stupid. People are going to raise their hand and go, I don't really understand what you said, Doc. Could you?
Yeah.
Like they just don't say it. And I know every one of them want to. And then what happens is they're like just confused a little bit at what they should be doing. And it's not the best way to explain medicine, but it's also not the best way to just communicate in general, right?
No, and you lose people very quickly.
Mm-hmm.
I think one thing that if you can teach a communication skill is you have to know your audience, and you have to be able to read the signs that they're not registering what you're saying, and you could keep droning on, but you've already lost them.
Mm-hmm.
You're already talking to the wall. So knowing, sometimes I'll change my approach. I have people where I have to be very proper. I get the people from Palm Beach to come in, and I lose my New York accent, and I become very proper, and I speak very very properly and very professionally. And there are other people who will come in, and the better approach for them is, hey, you know what? You're too effing fat, and we got to work on your diet. But you have to know who to use that approach with.
Because
you have to know your audience
and be like, dude, that doctor told me straight, I got to take action, right? Where someone else you could use that with, and they might be like, I'm offended. And I'm like, well, is he telling you the truth? Yeah. Was he unclear with his message? No. Okay. But but you're right. Knowing, in the challenge in that, oftentimes, and this is something I coach doctors to, is they're so focused on them versus the patient. Because if you're focused on the patient, it's like if I'm talking to my 12-year-old daughter, I'm going to speak to her in a different way than I might speak to you, because I want her to receive that message. And here's what's interesting, a lot of people don't know it. When you look at like marketing copy, like when you're writing copy for Facebook, or an ad or a website, stuff like that, the copy that is best converted and received is like a 4th or 5th grade reading level. So I've had docs, I'm like, send me the thing, and we have ChatGPT. Grab it, throw it in ChatGPT. I'm like, here's what you need to say. Well, that doesn't, I'm like, dude, they know you're a doctor. They know you're smart. They just need to know that what you're actually saying. Otherwise, they're going to go next. Like, who's the guy that's going to, because you can't connect if you don't understand.
I agree with you completely. And it's, like you said, they know you're a doctor. When the first couple of TV appearances that I did, the person who I was working with was a publicist, and she said, I want you to wear your white jacket. I said, but I don't wear a white jacket. I don't wear a white jacket in the office, and since my residency days in the hospital, I never wore a white jacket. She's like, yeah, but I want them to know you're a doctor. I said, all right, and I listened to her for the first time. I felt so uncomfortable because it just wasn't me, And I really find that when you're yourself and you can be, and this goes for public speaking or even just if I'm with a patient. You just have to be yourself and have enough confidence in who you are that, listen, once they hear me talk, they're going to see the little thing next to in the chyron next to my name. This is the doctor who comes on. Okay, fine. Right. So I think there's always that level of confidence in showing that you know what you're talking about, but you can't talk down to people.
Yeah.
Like I said, they know I got all the things on the wall. They know I went to school and they know I'm smart, but you don't have to make them feel any less smart.
Yeah, it's been a breakthrough thing with docs I've worked with, of just helping them. And some of it can come from, you're different. I've told you that 100 times, but most docs come from this place of perfection, right? So it's like the best grades, top of class, like they're striving for protection or for perfection, which is also striving to please others. And what happens is they can get stuck in this place of they're saying what they think they're supposed to say versus what they should say, and that message doesn't. It also can feel fake and kind of like it's like that plastic coat that's supposed to change something with anything. It could be a little more intimidating versus, and even me, a guy who regularly talks about healthcare. I'm not a doctor. I don't want someone to think I'm a doctor, and so I'm usually in a t-shirt or a polo or something like that too. But that it's so important to be able to connect your message with the listener versus using words to sound intelligent or sound important or whatever it might be, if that's not your audience, right?
Oh, for sure. And one of the best compliments I get from people all the time is, you're not like most doctors. Yeah. And I say, thank you. I said, because I hang out with comedians instead of hanging out with doctors. Awesome. But I think that you need to create that level of comfort with people, and it's like you said, they have to be able to tell you that one last thing. There's one other thing I want to tell you about. It really brings a lot of joy when you can pull that out of somebody and know that they felt comfortable enough to share that personal thing with you.
Yeah, that's super important. I think one of the biggest takeaways of this, is A, be yourself. That's probably the most valuable version of you. And then B, think about what you say and who you're trying to connect with the most. Because when it comes to, like you mentioned, like building a brand and some of those things, like when you're making like marketing content, stuff like that, that's some of the biggest challenges I see with doctors. You might spend a lot of money. Maybe you're spending 10, 15, 20 grand a month on Facebook ads, but your message is not being received, even though it's so good and what you offer is so good, right? But it's not connecting, right? So helping with working that messaging out and how to relay it, and then there's a skill, right, in like the hook and how you position the words and when you use them and stuff like that, like learning that stuff, because that same thing that gets those people to click can also, as a doctor, be the same thing that gets them to take the pill or do the thing or change the food, because it's a psychology thing, like learning that in the communication side, which I never really thought of it as much as when you brought it up, is docs aren't really taught communication, right? They're definitely not taught business, right? So it's like that's one thing, but it's like learning communication and taking the knowledge, applying it in the business, and then be able to communicate that in the best way. It's probably, I'm sure it has a lot to do with how you've had it such a successful.
Yeah, and it is hard to teach. I mean, there's a couple of simple things, because I've actually had people kind of bring me in to try to help other doctors communicate, because I've kind of always been good at it. Mm-hmm. And it's something so simple as knock on the door before you walk into the exam room. Mm-hmm. Give them just a little knock and walk in. Don't just burst in on somebody, even though they're dressed, or just give a little knock and let them know you're coming in. Mm-hmm. And just little things like that. And I always like to take you never jump in like, okay, what's going on? How was the trip to Europe? How was this? How was your daughter's wedding? Just that little bit. Their kid just got married. How was the wedding? Tell me about the wedding. It takes a minute.
Yeah,
but it helps to build that connection.
Yeah, it takes the edge off of like talking to the doctor, right? Which is
listen. Well, Adam, people don't like coming to the doctor.
Right.
It's not something that people enjoy. So my goal is to remove all of those things that people hate about coming to the doctor. Mm-hmm. So you come to my office, you don't wait. If you have a 9 o'clock appointment, I'm calling you in at 9 o'clock. Yeah. So people, you don't like to wait. I call everybody back. Well, I called the doctor, he never called me back. I call everybody back. Just those simple little things.
And those are like successful business principles, right? There's just
for any business.
Yeah, and so it's like, but in healthcare, sometimes it's got lost, where it's like, oh, your appointment's at 12:30, we'll see you at 1:30. Into the waiting room you'll be for another 30 minutes, and so then you get out of there at 4, and you're like, dude, I charge $2,500 an hour. Like, what?
Well, yeah, like your time. I always said my patient's time is just as valuable, if not more valuable, than my own. Right. Particularly in the area that I practice in, and with the kind of clientele I deal with, their time is more valuable than mine.
Yeah, and another reason why someone should have a concierge doc like you, and even in like the practices that I've owned, like simple stuff. I love how you mentioned like the knock on the door. Ours was like when someone walks in, you stand up. You greet that you know who's coming in because you know what the next patients are, and you're like, Mary? Yeah. Oh, hey, Mary, can I get you something to drink? Like just that little simple. And I remember when I'm trained, I'd be training other practices and this stuff, and they're like, isn't that a little meticulous? I'm like, it matters. The details matter. That impression matters. That warmness, like their experience matters. And I'm like,
it matters a lot.
$50 million practice on referrals? No. Okay, well I have, and you want to get people to refer people over to where, like you said, you have a waiting list. There's these little details that make them value their time with you, because like you said, no one likes going to the doctor, and so
that's right.
Make that experience great by just being kind. And one of the things I do when I hire people to work for me, this is a cool little hack, I would take them out to a dinner at like a 5-star restaurant. I wanted them to experience. I'm like, do you see the difference between this place and Chili's? Yes, it's more expensive, but like, you don't even know who your waiter is because you got 3 or 4. They're scraping crumbs. They're like your drink doesn't get. I was like, this experience. The food costs more and the bill's going to be more expensive, but it doesn't cost more to care this much, right? Because I wanted them to see that, and so it's like when you can teach that, because it's none of that's taught in medical school, or it's not taught in like how to start your own practice. It's all about like billing and scheduling and EHR and some of those things, and so we can teach that the success that doctors can have in their practice by just learning. It's like human stuff, and
Do you know where I learned some of this hospitality stuff? My first job in high school, I was 16 years old. I just got my license, and I worked in a hotel.
Awesome.
I was a valet parker and a bellboy, and I did it for like four or five seasons, in the summertime. And it was a high-end hotel, and they actually gave us hospitality courses, where somebody enters like a 6 or 7 foot radius of where you are. You greet that person.
Yep.
Good morning, good evening. You make eye contact. You nod at them. Just simple things like making eye contact with somebody, greeting somebody. It's not that hard. And I'm going to tell you one other trick for practices to put into place. Make sure the people who are at your front desk are emulating the same skills that you have. Because I have tons of practices that I work with, and I send people out to them like, listen, you're going to like Dr. So-and-so, but I'm going to warn you, the staff is nasty. You can't get through on the phone. If you can get through to see the doctor, he's great. But his staff are miserable and obnoxious.
Yeah.
You just have to fight through that. But I'm blessed with fantastic staff, but I think it comes from my attitude. They see how I am, and if I was miserable and nasty to people, they'd be miserable and nasty to people.
I kind of think of it like the doctor's a leader. You set the tone in the practice, and I've had those situations where the doctor, like him and I, awesome, or her and I, awesome, and then I see them engage with their team. I'm like, dude, you're a jerk. What?
Right.
I'm not a jerk to my patient. Like I'm like, oh, I see how you talk to your, and guess what? Your team's going to emulate. Because that's all they know.
100%.
Right? So
That's right.
There's like a whole shift of like, they're like, oh my gosh, I didn't realize this is who I was. I was like, yeah. So we're going to change that. I've had docs where they're like, man, you were so good at hiring and finding great people. How do you do that? And I was like, I treat them good. I was like, you treat your people crap. And I'm like, oh.
That's right.
One of the greatest hires I have still works for me over 6 years. She came from the hotel industry, so she understood that, higher end hotel. She was working at a practice at a front desk. I could tell the doctor didn't care, didn't value her, but she was smart. She could code, she could web design, like she could do a lot of cool other things that she wasn't, her potential wasn't being looked into at all. And I was like, hey, do you care if I take her? And he's like, yeah, no problem, replaceable. But I knew, and there was still, I'm still friends with that doc today. And he's like, she's still with you? I'm like, yeah, like making way more money, doing lots of stuff because she wanted to grow and do some cool things. But, being able to identify good talent, good people, versus just, again, treating them like a number. That's the front desk person, they're replaceable. Doesn't it suck to replace those people? Why don't you hire great people, have a good standard, see how you treat them, and then you have that person that can like run your practice for you, right?
And treat them right.
Yeah.
You have to give them skin in the game and make them feel that it's not my practice, it's our practice. We should all be proud of what we do here. And what do they say? Excrement rolls downhill. So if it starts off bad at the top, it's going to roll downhill. But good stuff rolls downhill too.
Oh, absolutely. You lead by example, and so that's it. One of the things we have in all the companies that I've been involved with is every patient, every time, no exception, no excuses. Right. So we use that in every situation. Did we call them back within 24 hours? Like, did we do all those things? And that's kind of the core philosophy of everything that we've done. And what I also teach is like, it can't be, oh, that patient's, I've worked with celebrities, and you probably work with a lot of those high profile people. And I explain, like, look, that person's high profile and it's great to treat them that way. But this person who's kind of a nobody, it doesn't cost more. It's not extra effort to make them feel that way.
That's right.
I had a lot of successes. I had a lot of celebrity people, a lot of those kind of who's who, but I still treated everybody with that same level of service. It didn't cost more. It wasn't more effort. It was just like, that's who I am, how I'm cut out. And then teaching my people, like, that's how we treat people. That's how we communicate, across the board. And then you can build a massive practice with referrals, and you get to work with great people that value you. And I think that's what everybody wants.
What's a great compliment to me as well is I have quite a few physicians who are my patients. Mm-hmm. And when another doctor puts their trust in you as a physician, that's a big vote of confidence. Yes. That means a lot to me. I've had quite a few physicians as patients over the years, and that's like the greatest vote of confidence that I can get. That's huge to me.
Yeah, and I think there's two parts. Your personality of like, you're just like, you're a guy, I want to be friends with and hang out with, and so there's an attractive part of, and it's like you can solve a problem for me, which could be my health, right? So I think having that, especially doctors, there may be a lot of good doctors, but they're like, man, I don't I hope this guy's out of here in 6 minutes, right? For
Right,
who's
exactly.
like, I'd like it to sit and talk for 20, 30 minutes with you. And who knows what may be uncovered with my health by creating that kind of container through the relationship, right? Connecting. So, and you do a great job doing it. So I hope anybody that might be in your area that wants to hop on your waiting list to do that. And I think, you're even though you've had a successful career, I think you're just getting started at all the cool things that you're going to be able to do with media and sharing the message, because you're a great doctor and you have just a great way of seeing medicine, and I think your love for people, which is awesome. And you're also, you have a lot of the values that I share. And so I think those shared values, I also want to work with somebody who has aligned values with me too, because I think we're, I just trust them a bit more, right? And so that I think you fall into that category as well.
Well, I appreciate the kind words, Adam. That's very nice. I really do appreciate it.
Listen, I don't know, is any last message, anything you want to share before we hop off? But otherwise, this has been awesome. Been blessed to have you as a guest. Grateful that you've been here.
Well, thank you very much. And I think my message would just be that you have to, the people out there listening, to take your health seriously. Do it from a young age.
Yeah.
Don't wait until you're 40, 50, 60. What I love is getting something like a late 20s, early 30s person who's not taking good care of themselves. I can mold that person. I can help that person. Don't wait. Spend money on your health. It's the most vital thing that you have to take care of. And it really pays off because it works every time. Mm-hmm. Healthy lifestyle doesn't fail. It works every time. It doesn't always get you to the place you need to be, but you'll always be in a better place when you live a healthy lifestyle. And one day I'd like to get more into some of the other stuff that you're working on, because I'm really interested and I'm open-minded to sort of the cutting-edge stuff that you're working on. And I'm open-minded to a lot of these things because, you know what? The things that I learned in med school, half of it turned out to be wrong.
Right.
So, so you have to keep an open-minded.
You admitting that, I think, also people want to work with a doctor who's also learning and new things, because things change, right? Some things were wrong. Like you said, some stuff was just, oops, that was wrong. We got to pivot that. Some people that, even though it's wrong, they're like, I don't want to see it or believe it. Well, it's like, you just change. So I love that you do that, is like continue to learn and what else is new, what else is possible, and how can I help people more. And we'll spend more time talking about that too, you and I,
man.
Diving deep into that. So thank you all for joining. Like and subscribe to this episode. We're grateful to have you on here, and check out Dr. Frank Contessa. Is there a website that's best for them to go to find you, or Instagram?
You can Google my name and it comes up. MDVIP is sort of like my parent company, and then follow me on social. If you Google my name on X and Instagram, I usually post whenever I'm appear on the news, and anything interesting I'm doing, I might post on there.
Awesome.
But thank you very much for having me, Adam. It's really a great pleasure.
Show notes.